Hello, and welcome to Time of Death.
I'm Ris.
And I'm Dee.
And welcome. If you are new here, we are two nurses that love talking true crime. We like to focus on cases that have a heavy medical influence to them or cases that feature a medical professional as a perpetrator or victim. So without further ado.
Thank you, Ris. Great intro as per usual.
Thank you. It's the same every week, so it never gets old, huh?
It never gets old. So I want to just give a heads up that the content tonight does cover some very disturbing things, specifically sexual assault. And so just a heads up before we get into this, if this is not something that you're in the right headspace to handle, at this time, just feel free to skip this and we'll see you next week. So without further ado, we are going to dive deep into a chilling case, which unfolded right in the heart of Beverly Hills. And no, we are not talking about Beverly Hills, Chihuahua.
Not
Beverly
tonight.
Hills, Chihuahua.
Maybe next time.
Mom, you look intrigued.
What is that? Beverly Hills Chihuahua.
It's a movie about a Chihuahua that lives in Beverly Hills.
Oh my God. You should have Lily watch it.
So, if you're like myself, I had to literally Google, why is Beverly Hills a big deal? And because I live under a rock. But Beverly Hills famous for luxury real estate, upscale shopping areas like Rodeo Drive. And a lot of celebrities live in that area, including Chihuahuas. Mm-hmm. So Dr. Babak Hajjhosseini, I said that totally wrong, and I'm going to just refer to him as Dr. H from here on out. Dr. H was a renowned physician who was recently accused of drugging and assaulting his staff members in his own home.
Oh boy.
It's a story that involves, a gross abuse of power, and also really highlights the dark and dangerous world of date rape drugs. So just bear with us as we delve into this case and really unravel all of the disturbing details. And just to say this, please, this is all alleged. This is still in court. And these are speculations that we're making based on the evidence that's available to us. So I just want to be clear about that as well. So who is Dr. H? At first glance, he's just another high-profile doctor making a name for himself in Beverly Hills. He is 42 years old and founded the Wound and Burn Centers of America. So he's an established and well-regarded physician, and was a contributor to medical innovations in his field, specifically wound care. He's even worked as a visiting physician on Catalina Island. It's one of California's Channel Islands. It's known for its wildlife, dive sites, and Mount Orizaba, its highest peak. And if you want to take a ferry, you can. It's about an hour away from California to Catalina Island. It's like a getaway for the elite as well.
Okay.
By all accounts, he was a respected figure in the community. And again, this was all until very recently when the allegations against him surfaced. In November 2024, Dr. H was arrested after a staff member accused him of raping her after he drugged her. According to reports, the victim was invited to Dr. H's home under the guise of overtime work. I also saw online that he paid people very, very well, which was also another big draw. So the prospect of overtime is what the impression this staff member was under. Once in his home, she was given an alcoholic beverage, which she later described as making her lose control and consciousness. And she woke up to find herself being assaulted and, horrifyingly, learned that Dr. H had filmed the entire assault.
So she found out right after he had filmed it.
Mm-hmm. And I just want to be clear, there's a lot of details that have not been released to the public yet because this is a relatively newer case and it has not all the evidence has not been presented in court yet. What's even more disturbing is that this is more likely than not an isolated incident. The investigators on the case believe that there may be other victims who have yet to come forward, which makes this horrible case even more chilling.
Mm-hmm.
Dr. H was released on bail after his arrest. His defense team claims that the accusations are very much false and that they have evidence, including polygraph test results, that prove his innocence. And I just want to interject here. I don't know if it is interjecting if I'm already speaking, but it's not impossible to fake a polygraph. And, this is a medical doctor. There's different medications like beta blockers that are specifically designed to work for
Control heart rate and any physiologic reactions that they look for during polygraph testing.
So it's not unimaginable that he would be very well aware of the different things that are available to him. And then also, there are resources out there to be polygraph tests as well without medications. Is going to fake a polygraph, who better than a doctor to know how to do that? So despite the ongoing legal battle, the medical community is really left shocked by these allegations. And for many, the most pressing question is, how could someone in such a position of trust, position of authority, really abuse their power in this horrific way? I also want to talk about a critical part of this case, specifically date rape drugs. While, again, the specifics of the case are still being investigated, it's important to understand the types of substances that are used most frequently to commit these types of crimes. The term date rape drug is used to describe any substance that is intentionally used to incapacitate someone for the purpose of a sexual assault. These drugs are very dangerous. They're often administered not by people who are doctors. And victims frequently have no recollection of what the heck happened to them.
Mm-hmm.
So the most common type of date rape drugs are Rohypnol, GHB, ketamine. All of these drugs can cause memory loss, extreme sedation, or even cause someone to become unconscious, making it impossible for a victim to fight back or even remember what happened.
Mm-hmm.
And it's terrifying that these drugs are tasteless, odorless, and colorless, which they are able to slip into drinks virtually undetected.
Mm-hmm.
I recently found out that there is some kind of a cap or covering for it's designed to cover a drink. Like if you go somewhere at a bar or a restaurant with an alcoholic drink, and as a deterrent for someone to put something in your drink. They sell these things. I never heard of them before, but I had seen one, and I think it's a good idea.
That's interesting. Did you hear about that nail polish that, I think they were college students, but they created a nail polish that when you dip your finger into a drink, it will turn a color if it has a specific type of drug in it.
That's cool.
So the first med, Rohypnol, is a fast-acting drug that really can incapacitate a person within 20 to 30 minutes after they consume it. It's sold illegally very frequently. Although it is a prescription drug in a lot of countries, it's illegal in the United States. Rohypnol can cause severe memory impairment, again, making it really difficult for these victims to remember what happened. There's too many variables to say because there's not enough details that are even available to us. What was she dosed with? Did they do a Utox? Did they do this? We can only speculate. We can only give the facts.
Yeah. Her size, her weight.
Mm-hmm.
Because, this is interesting because like Valium or benzos are picked up by your lipids. So that's why it's meant for your brain a lot of the times. That's why we give benzos. But if someone has like a increased fat distribution from when the medication was originally prescribed, it might not work as well because it's going to go to other tissues and kind of leave the brain more vulnerable or, less less attention to the brain, which is kind of interesting.
The medications are really, it's important to understand the pharmacodynamics of these meds. And I just threw a big one.
Pharmacokinetic. Pharmacokinetic energy.
Pharmacokinetics, I think, is what the body does to the drug. The next drug is gamma hydroxybutyrate, or GHB, and it's referred to as liquid ecstasy. GHB is a central nervous system depressant that causes euphoria, drowsiness, lack of muscle control, and when it's mixed with alcohol, it can often be deadly. So that's another important consideration as well. Finally, ketamine. Known as dissociative anesthetic, ketamine is commonly used in the medical settings for anesthesia. But when abused, it can lead to hallucinations, confusions, again, memory loss, and victims who are drugged with ketamine describe the experience as feeling almost being detached from their own bodies.
That's what we call a K-hole.
The K-hole. Mm-hmm. And they're oftentimes watching the events happen to them from the outside.
It can be very scary.
And you're right, Ris. It's terrifying. And not only is the K-hole terrifying, but what happens while people are incapacitated is horrible. And a lot of times people don't even realize that they're a target until it's too late.
Yeah.
And I think this is another reason why it's really crucial for everyone to understand the signs of being drugged and to take steps to protect not only ourselves, but other people. So the question we really need to ask ourselves is, how does a respected doctor like Dr. H fall from grace in such a horrific way? And what does this mean for the medical community, right? Because we are members of that community. I think this case really is a prime example of a betrayal of trust. Medical professionals, especially doctors, are held in high regard and in a unique position of power and authority. And with that power comes great responsibility.
Oh my God.
They really have a moral responsibility to act with integrity, respect, not only to their patients, but to their staff.
Yeah, that's true.
Good point. Good thought. So his actions not only damaged his career, but really have shaken the public's trust in medical professionals as a whole, understandably. Mm-hmm. Questions have been raised about how well healthcare facilities are screening and monitoring their staff, right? Whether more could have been done to prevent situations like this from ever happening. In response, a lot of hospitals and clinics are now reevaluating their internal policies. And some are even implementing more stringent background checks and employee safety protocols, which I think is well warranted. But it's really sad that it takes something like this to happen for more stringent. Do you know that one of the highest incidences of psychopaths are surgeons?
I can see that.
They have a very high rate of psychopathy.
I think I've heard that. I think I've heard that before. Don't dentists also? Or I think they were just very susceptible to depression.
I don't know about
and
the
suicide.
dentist. I'm already scared enough to go to the dentist. I don't need any more fear. I mean, think about it. If you really happen to inflict pain on another person, you really have to be able to detach yourself. And surgeons are cutting into pieces of flesh. Dentists are drilling holes in your mouth. Except me, I've never had a cavity.
You know what? The other day I went to the dentist and she's like, "Oh my God, you have no cavities. You have no fillings."
You should have a filling.
She said, you've never had a filling. You have no fillings. Like, this is really rare. And I was like, well, I had several when I was little.
Your baby teeth.
It was my baby teeth, but there's no more evidence of them.
Wow, all that. So you skated by.
I just skated by. No evidence.
But, the unfortunate reality is no matter what measures are put into place no matter what measures are put into place, unfortunately, this case will always serve as a reminder that as much as we can trust people in positions of power, there are always a bad apple in the bunch. And, it really is up to the public and the medical community to hold people like him who do things that are horrible and awful to hurt other people accountable for their actions.
Yeah.
Now, let's talk about how we can protect ourselves and other people.
So has he been charged with, it was just this one event?
He's been charged with this one event. He was arrested November 26th. And charges included rape by use of drugs, rape of an unconscious or asleep person. He actually posted bail and has been denying to the allegations, referring to them as false and salacious. So, again, he is innocent until proven guilty. The best defense against date rape drugs is awareness. So us just even talking about it, especially on this forum, helps promote awareness about it. Understanding how the drugs work, recognizing symptoms, and knowing how to take precautions are essential for people to stay safe. First and foremost, always keep your drink in sight, whether you have a cover on it, whether you have your hand on it, whatever. If you're at a party or in a social setting, do not leave your drink unattended. This is number one way to stay safe. And if you do have to leave it behind, dump it, get a new one. Another step to keep in mind is to watch out for signs that someone might be trying to drug you. If your drink tastes strange, if you feel really, really drunk out of nowhere, or if you are starting to experience memory lapses, these could be signs that something has been added to your drink.
Can I just give in some input with I have a sexual assault forensic examiner certification. So just so everyone's aware, it's just a tidbit here. For the kits that we use, there's a portion where if you've had loss of consciousness or dizziness or anything that's kind of off.
Balance.
Huh? Your balance is off. You're uncoordinated, and especially doesn't match up with the story. I only had one glass of wine and I ended up at my coworker's house and I had no idea what was happening. And I don't think it correlates with how much I drink. That we've done kits for that too, but I don't know if it's a nationwide thing, but that's how we do it where I am. And I'm sure that other states do it as well, but because I think every kit is a little different for each state. But anyway, it's just interesting. We send a urine and a blood test.
Good.
When we are suspicious of that. But, anything that they may have taken voluntarily will also show up on the test, of course.
I think that it helps piece together what might have happened. Hey, I did take this substance consensually to see, is there an interaction? Could these symptoms be caused by something that they took versus something that they were given non-consensually?
Exactly, yeah.
You being a safe nurse is really amazing. I was so proud of you when you went for that certification. I think that, on some people's worst days where they're, potentially been traumatized and, the fact that you're someone that is able to support them and help, build a case, it's a big responsibility. And then the emotional connection that you have, yeah, that's a big deal.
It's been, I tell a lot of the new nurses to take the course as well, to take the certification as well, because any nurse in an ED can have a patient with sexual assault. That's where they come after sexual assault occurs for some of the time. So just having that knowledge has really helped me and helped me be a better advocate for my patients. I think it just gives you more information, more knowledge in that area.
And what too that I learned from you was very interesting, was that a lot of times if people choose to pursue an arrest or for whatever, it's used in the investigation. So it's evidence that you're collecting.
Yeah, exactly. Yeah. It's forensic evidence. So, yeah, we collect all kinds of stuff. We do blood, saliva, like touch DNA, any debris that might be there, like leaves in someone's hair, like cat hair. It's pretty cool. And then, well, not, I mean, it's interesting. It's it's horrible that we have to do it, but it's cool that there is that forensic examination. And then we also, like, if someone's wearing a tampon or a pad, we usually collect those. A patient can refuse any step. You can stop. The whole thing takes a couple hours. Like, average, I think, is like 3 or 4 hours for the whole start to finish. And most of mine take around there. For me to, like, start the case to be handing it over to police takes about 5 hours, I'd say. Like, for documentation, everything, that 4 or 5 hours maybe. And anyway, so there's all those steps. We collect clothing from the patient. We do external genital swab and internal genital swab. The provider does a internal exam with a speculum if it's a female patient. Actually, I can use a speculum and do a cervical exam. I was trained in the certification, but the hospital I work at doesn't let nurses do that portion. So I'll do everything in the kit up until the vaginal exam, and then a higher level provider, NP, PA, doctor, whoever comes in and they do that portion. And then the last step is a rectal swab. And then we just ship it off. But there's also like a lot of written portion. So you will do the story, and we do the story verbatim. And then we do like a physical exam of the patient. You have to document any wounds or any new injuries to the patient. We do not take photographs. I think they used to do it, and some states do it, but now it's just police that takes photographs.
At any time, can that person refuse to submit it to the police?
Yep, they can change their mind at any point. It's very, like, patient-led. So I tell the patients, you can stop me anytime if you don't want to continue, or if you need a break, or if you don't want to do one of the steps, because there's 12 steps. It takes a long time, anything they can refuse. And if they decide after it's all done, they were going to report it to police, and then at the end they decide, no, I'm not, I can change whether or not we put their patient information on the box. If they are reporting, we put their information on it and hand it to police. If they're not, we put like an anonymous control number on it and then hand it over to the police.
What if they go that route and anonymously submit it? Could they change their mind after that?
They can change their mind in the state we're in. They could change their mind within a certain time frame. I don't know about other states, but in our state, there's a certain amount of years that they can change their mind.
Is there anything that when someone is sexually assaulted, what should they do? What's the first thing they should do? Okay.
So if someone's sexually assaulted, and this is like not best case scenario, but this is ideally what would happen. And it always can be, most of the time it's never perfect, because most of the time when people are sexually assaulted, their first instinct is to take everything off, take a shower, cleanse, because they just were severely violated. So, but ideally a patient's going to come in wearing the clothes that they were assaulted in. They don't eat, drink, pee, anything before coming in to see us. So just ideally immediately after the assault, they come to the ED. We only have a certain amount of time. So when a sexual assault occurs, again, this is different for every state. I don't know if every state is different in this regard, but a lot of the things I'm talking about are just pertinent to my state, so it's probably different in your state. But when a sexual assault occurs, we have 5 days that evidence can be collected. After that point, we can't do a kit on them. Anyway, that's it.
Rissa, thank you. And just wanted to reinforce what Riss said. If you feel that you've been even just drugged, never mind you think you've been assaulted, please go and seek out medical treatment immediately, as soon as possible. And this is not medical advice. This is just, in terms of the quicker that you act, the better chance of detecting what drug might be in your system.
Yeah. The time frame for if you're drugged, the time frame for that is less than the 5 days. So I think it's only a few days for that, for urine and blood, even less, I think, for urine.
So just back to Dr. H's case, it's very clear it's far from over. With multiple victims suspected and an entire legal battle ahead, it's going to be a long time before justice is served. And, we can only speculate about the true extent of the crimes, but one thing is certain, that this case has brought a dark undercurrent to the very forefront of the medical community and has left, again, a lot of people questioning how far a person can go to abuse their power. And we just want you guys to stay safe. Knowledge really is power. I want to thank Riss for a very in-depth breakdown of, what sexual assault nurse examination really entails. And, hopefully this is information that can help someone down the line. It's a horrible, awful, tragic thing, but again, being informed really can help keep people safe. So we covered how to keep yourselves safe, how to keep other people safe, what to look out for. And, hopefully it never gets to that point, but information about what the medical realm would entail. So thank you guys for...
One more question. I think it's very relative and important is what kind of steps happen after a woman or man is raped? What kind of supports are necessary for healing from the trauma of this experience?
Well, what happens after we have the advocates that can come see them? We really try to emphasize like a support system for patients because that is very helpful. Following up with a mental health worker, mental health professional. It's also very beneficial. Everyone's different. Everyone, copes differently, especially with something as life-changing as that. So we just try our best to be there for them in the moment and try to, set them up so that they have what they need when they are discharged.
Great question, Mom, and great answer, Riss. So thank you guys for tuning in. I hope everyone is safe. Again, I hope everyone's 2024 is off to a good start. Oh, 2025. 2024, I'm going backwards. And we'll see you guys next week.
Do you want to call it or you want to just leave them hanging?
We're going to call it. I am all over the place. It's 2022.
That is 8:22 p.m. for those of you who do not use military time. And we're out of here.
Bye.
Bye.